As people learn of family members and friends testing positive, lines like this one at Al Lopez Park testing site are just growing. In some cases, people are waiting hours to get a test. Now, Florida Surgeon General wants to tweak our testing system, specifically prioritizing who should get tested. 10 Tampa Bay's Miguel Octavio took that plan to health experts.
The state surgeon general says we should change the way we test for COVID-19.
If your grandmother gets a test, that's a much more valuable test than the 8-year-old, third graders that Los Angeles County is sending in to get weekly testing.
Some doctors agree that tests should be prioritized, but only for the time being.
In an ideal situation, we would test everyone. But if we can't do that, we can't.
With demand high and supply low, doctors say this may be our best choice for now. Dr. Thomas Unash says if you're not exposing anyone who's vulnerable, you're probably less of a priority for testing
than if you are living with someone who is more vulnerable, or you yourself are one of the more vulnerable population groups.
But Dr. Michael Tang says the guidance doesn't work.
Therein lies the problem of not having enough tests.
He says knowing who should get tests first is more complicated.
It's people with medical vulnerabilities that are high priority, but many of our residents can't afford health care or don't know that they have medical vulnerabilities because they haven't seen a physician in years.
Doctors stress testing is still one of our main weapons against the surge. But even if you can't get a test right now, you can still protect others.
If you're feeling like you're getting sick, it may just be a good idea just to stay home.
Whether or not it's COVID, it's probably an infectious disease. And so you should still do the same mitigation measure.
The state will officially release its testing guidelines soon, but for now, here is the bottom line. If you feel like you might have COVID, get tested, but if you can't, just stay home to prevent the spread.